impact on the rest of the chiropractic profession.
Yes. Same. I want it to be really positive, and I want it to be uplifting, and I want it to be really impactful. I want people to take an action. I want people to do something really big with this.
And they will.
This information is going to help them.
So everybody, I just want to welcome my guest presenter today because
I want people to do something really big with this.
Oh, we're getting feedback a little bit. Okay, so y'all know me. I kind of like fangirl just a little bit every now and then, and today is one of those days. So Dr. T already knows how much I love her, and I've been a huge fan for a very long time, and we are so excited that we were able to work it out with her incredibly busy schedule to have her here today. So I'd like to welcome as a first-time presenter on our webinar series, Dr. Irum Tahir. And let me tell you why she's so amazing, besides being dynamic, beautiful, just absolutely amazing and inspirational. She's an international speaker, a chiropractor, one of the top 100 entrepreneurs under 30 years of age in the U.S. What? She's done a TED Talk, like that's on my bucket list, and it's fabulous. So go look it up. She's absolutely amazing. And this is what I love about her. She walks the walk and she talks the talk. She knows what she's talking about. She's put this into practice. She's not just selling y'all a dream. She's laying down the truth. So I'm going to stop talking right now so I can turn it over to the Dr. Irum Tahir. Thank you for being here.
Thank you. Thank you so much for having me. I'm so excited to be here today. Thank you so much for ChiroHealthUSA and for Christy for setting this up, and for Heather too. You got to give her a little props too, because she's kind of part of it too. I'm really excited about talking about how to build the largest wellness practice in your city with medical doctor referrals. And we know that prescription drug abuse is the strongest risk factor for heroin abuse or dependence. So we have a real problem in the world today, right? Like, do we think people are healthier than ever, or are they sicker than ever? The answer is they're sicker than ever. Are they on more medications than ever or less medications than ever? The answer is that they are on more than medications than ever before, right? 210 million people are on at least one prescription medication. 210 million people. So the population of the United States is around 300 million people. So 210 million people are on at least one medication. Now, I know I'm not on any medications. Maybe some of you may not be on any medications. But that means that there's somebody in Piscataway, New Jersey that is on 3, 4, 5, 6, 7 medications. And it's just getting worse. It's getting bigger than ever, right? And we know that a big part of that is opioid addiction as well. So we have a real opportunity to help change people's lives and save people's lives. And in chiropractic, we say that you didn't choose chiropractic. Chiropractic chose you. So somehow, some way along the way, you ended up in chiropractic. And what's exciting is that there's a reason that you're in chiropractic. If you think back to the first moment that you got into chiropractic, you can see that there's been a path for you that got you here. And in fact, there's a path that got you here to this webinar as well, right? For me, I believe that we have the answer to the world's problems, right? We know what we have to do with chiropractic, but the problem that we have is the utilization rate of chiropractic is what, 12%, 14% at the high end. So that means that most people are not using chiropractic today. And now this is a picture of me when I was working with Syrian refugees. I went to Jordan and I wanted to do something about the Syrian refugee crisis. I just felt like I wanted to do something. And I kind of pushed my way into this organization that is a medical organization. It's all doctors that go to war-torn countries or areas in the United States or internationally that are hard hit by destruction or war and things like that. And I just felt this calling that I wanted to bring chiropractic to people. And I pushed my way into this organization. So it was 17 medical doctors, a pharmacist, and me. And in the beginning, all of these medical doctors were like, why are you here? You're a chiropractor. What are you going to do? and they wouldn't refer to me. And we were only there in the beginning for a week, you know? So in 4 days, I saw 400 people, and I had the longest line out of any one of those other physicians. And the thing is that they were starting to send me people that had things like night terrors, bedwetting, stress, trauma, PTSD, right? So I was able to, in that week, educate chiropractors. I was able to educate the medical world about chiropractic. And in this short time that we have together today, I want to share with you exactly what it is that I did and to be able to help educate those doctors. Because I think that working with medical doctors is going to be the key component in being able to drive your own business forward. So I'll tell you a little bit about myself. You know, chiropractic, I believe it chose me. My dad is a medical doctor. If any of you know my story, my dad and my parents really wanted me to go to medical school my whole life. And I decided otherwise. You know, I grew up in medicine. We were given medicine for everything. We're all fully vaccinated and everything like that. And we just, anytime we were sick, we just went and got whatever the medicine that we needed. And it was really when I got to college, I started questioning things a little bit. And I remember the moment that I decided to become a chiropractor. I was shadowing a chiropractor up north near me, and he worked with a lot of Mennonite and Amish population that just don't really see medical doctors. And this patient came in with chest pain and numbness and tingling down into the left arm. And I'm just thinking, this guy needs to be in the hospital. Like, why is this patient in this practice right now? And Dr. Vanier diagnosed it and figured everything out, that it was just a rib, and he adjusted him. And that man went, ah. And that's when I said, I want to do this. And I thought that that was the coolest thing. And so I really had to kind of fight with my parents in the beginning to be able to push for chiropractic, because they just were thinking, why wouldn't you go to medical school? So I graduated, and I decided that I was going to build the biggest, baddest practice I possibly could to really prove my parents wrong, that chiropractic was really worth it. And like, thinking about it, I mean, they had said to me, once you're done with chiropractic school, make sure you go to medical school to complete your education. So that's how they were really, really set on me going to medical school. Those of you who remember chiropractic school, it's like, how can I go to medical school after this? I don't want to. So I built this practice. I started out by renting space from a chiropractor. That practice got bigger. I moved into my own location, and I did everything. I was the front desk. I was the billing person. I was the chiropractor. I was the janitor. I know some of you can relate with me on that. And those early years were definitely difficult, but I kept growing. The practice kept growing. I learned a lot along the way, and I learned what to do, and I learned what not to do. And I had some amazing accolades along the way. I was named one of the top 100 entrepreneurs in the United States under the age of 30 by President Obama. And I was able to bring chiropractic to the forefront and bring it to a place like the White House, where I was chosen to speak, right? I was able to bring it to the United Nations, where I was chosen to speak. I've done a TED Talk as a chiropractor, and that just crossed 500,000 views. And I was chosen to speak because I want to keep pushing chiropractic to the forefront. And my goal in the time that we have together today is I want to share with you tactics that I've used in my own practice that have allowed it so that new patients constantly come into the practice while I educate medical doctors. So now my practice is pretty amazing. It's this 4,500 square foot building. It's in upstate New York. And I love it. We have chiropractic on the bottom floor, and we have other practitioners who rent space on the top floors. And one of those practitioners is actually my dad. My dad made a complete 180, and he actually went more into functional medicine. And now we actually share patients together, which is so cool. So, I really, for me, what's really, really important is education, and educating our doctors and educating providers about the value of chiropractic. So today I live in San Diego, California. My practice is in upstate New York. We're 3,000 miles away. And I've been able to operate this practice because of the systems that we have in place, number one. Number two, our team is the backbone of the practice. I'm sure all of you know that. And then number three, having a consistent system that I'm going to share with you today of how to get new patients in the door. And I just hired on 2 more doctors. I've got a doctor that's just started, and then another one that's going to come on in January 2021. And some people may be thinking, how do you even know you're going to be able to pay this doctor in January 2021? The reason I know that is because I have consistent streams of new patients coming in from medical doctors. So I am 100% sure we'll have new patients for this new doctor too. And so now we have the system in place, and I'm lucky enough to be able to coach chiropractors, and I teach chiropractors all over the country and the world. And we do that through a program called the Ignite the Spark program. And in that, we teach chiropractors how to systematize their practice, how to automate it, and how to be able to get their practice so that they're working more on top of the business as opposed to in the business all the time. And then they're not the ones having to do everything and getting burnt out. So my true passion is really working with chiropractors so that we can actually get that utilization rate higher, because I know I'll never work in Montana. I know I'll never work in Alabama. I know I'll never work in Mississippi. Sorry, Christy, I'll never work in Mississippi. But I'll never work in Alberta, Canada, or any of these other places. But if I can get you to start shifting things and getting new patients in the door from medical doctors that would otherwise be under drugs or surgery and have no other options, that's how we can change this world. So for me, it's a really personal mission. But what I want to have for you in the short time that we have together today is I want you to walk away with what we can start doing working with medical doctors. And I'm going to share with you at the end like what you can actually start implementing, and a program that we work with. It's a 6-hour class, and you'll be able to understand a little bit more about it, and where we go more in depth into the teachings. But I think in this hour, you're going to at least walk away with 1, if not 2 things that you can start doing right now. So the first thing that I want to start with is painkiller pain versus I need a vitamin. Okay, now what does this mean? Now we know that, of course, we try to avoid drugs and surgery. So I was a little hesitant to use this example, because we're trying to avoid painkillers. But let me tell you something. I've coached chiropractors for 7 years. And what I do know is that most chiropractors have some kind of painkiller pain. Now, what is a painkiller pain? If your humerus is shattered just like this, you're going to be in excruciating pain, right? You could love chiropractic as much as you want, but you need that painkiller, right? Like there's no way you're going to be able to take this kind of pain. I think very little people in the world can actually take that kind of pain. So that pain is like a throbbing pain. It's a 10 out of 10 pain. It's a constant pain. It's something you wake up with. It's something you sleep with. It's something that you know is there in the back of your mind, but you just don't know how to solve it. Versus I need a vitamin. I'll take magnesium, I'll take vitamin C, I'll boost my immunity, I want to make sure to, reduce inflammation. I need a vitamin. Versus that painkiller pain. So most chiropractors that I have worked with, and I've worked with hundreds and hundreds and hundreds of chiropractors over the years, because as I started becoming more successful, people would ask me, what are you doing? How are you doing it? So I'm going to share with you one of the biggest systems that I have here today. But what I want you to start looking at is, what is your painkiller pain? What is that break leg pain that you have? And we actually have a poll with these, and I've found in the last 7 years of doing this, there's 9 break leg pains that most chiropractors have. Now we have a poll that Christy has created, where we're going to be able to start looking at what is your break leg pain. It's completely anonymous poll, and Christy's going to share the results with me, and I'm going to share it with you as well, because this is what we need to do. We need to take the blinders off in our practice, in our profession, and we need to start addressing the issues that we have. And that's the only way we're going to resolve this break leg pain and this painkiller pain. So I'm going to give you a minute, and we're going to just poll right there of what that break leg pain may be for you. And then Christy's going to share the results with me. But most people will fall into not enough income, right? I don't have enough revenue coming in. I can't hire staff. I can't hire employees. Not enough time, uncertainty of the future of the practice, not reaching the goals that we have, whether they're personal or professional, no plan of action for the practice, feeling that you're not contributing to the family income as you wished, anxieties and self-esteem issues. And I will tell you, this is something that is really prevalent, and I myself have dealt with this because my dad is a medical doctor. I've grown up in medicine. I really had this insecurity as a chiropractor. And really maybe that's kind of why I'm overachieving in a way. Maybe that's why I want to really push into chiropractic, like how we can work with medical doctors, because I had that insecurity before. How am I going to talk to medical doctors? Even though my dad is a medical doctor, and I've grown up with medical doctors, and all of our friends growing up were medical doctors, and all of their kids were medical doctors, I had this insecurity of, how am I going to talk to a medical doctor about chiropractic? Are they going to quiz me? Is there going to be an anatomy lesson, right? So that's a very real thing, anxiety and self-esteem issues. And then chasing products that make up for lack of income, like oils, pillows, MLM, unrelated products. Now, is there anything wrong with MLM or oils or pillows? No, I sell pillows. I have supplements in our practice in Syracuse. But the thing is that this is not where most people try to make up a lack of income, which is actually in this poll the #1 thing that most people said that they haven't, a break leg pain, not enough income, second only to not enough time. If you have this challenge, most people are grasping for another certification or another gadget or another pillow or another product or makeup. I can start selling makeup in the practice or whatever the case may be. There's nothing wrong with that. But that cannot be your primary income. You will never make more income than anything else but chiropractic, I will tell you that. It just needs to be automated. It just needs to be systematized. And you know that when you're starting to, yeah, thank you, Christy, for sharing this. It's that most people are really saying that not enough income and not enough time is what they have. So what I want to share with you is that this is going to be the path of least resistance. You're going to see exactly what I mean. So I'm going to share with you here, these are 8 components. This is the pain reliever. This is the pain reliever. This is the pain reliever that you're going to need in your business, okay? And these things right here, I want you to take a picture of, and I want you to look at this because this is where you're going to start looking at these 8 components in your practice. A healthy revenue stream, right? So when people take our weekend class, that's the #1 thing we do. We create a revenue plan. Most chiropractors, I'm going to tell you 100% of chiropractors who've gone through this weekend class that we do, they don't have a revenue plan. There's no plan. So they need a revenue plan. They need a healthy revenue stream. They need to have a clear new patient flow. I don't mean a new patient exam. I mean a very clear new patient flow from beginning to end and looking at the inefficiencies in that flow. Having an excellent team in place. This is the #1 complaint that we get from chiropractors is hiring and firing people, right? How do we do it? Why are we doing it? Retaining employees. I know you know what I mean out there. I've dealt with it myself. I've skinned my knees. I've skinned my knees on this. Understanding how to communicate chiropractic to the patient and getting retention. Great relationships with MDs, which is what we're going to talk about today. And hiring excellent associates, becoming considered the expert in your city, and having and ensuring a web presence and learning to automate and execute systems using a policy and procedure manual. So we're going to touch on the MD referral program today. And what I want to ask you here in the second poll that we have is there's lots of different methods of acquiring new chiropractic patients, right? We know that. We've all done our share of screenings, right? Lots of different locations. We've done events in music festivals, farmers markets, health fairs, health stores, libraries, group talks. Now, if you've ever followed me on Facebook, you know that I've done this over the years, right? I've been at marathons. I've adjusted sweaty people. Even though I myself don't run in marathons, but I've adjusted all the sweaty people in the marathons. I've tried to get patients that way. I've done Facebook ads. Actually, I've not done Facebook ads, but a lot of our clients have done Facebook ads. I've done, of course, people do Google searches. There's new patient specials. So there's $127 exam, where you can just get it for $47, right? Internal referrals, external referrals, and of course, working with referrals from a patient's medical doctor. So I'm going to give you another minute, and you're going to do a poll, and you're going to start seeing, we're going to start seeing where are you actually acquiring new patients from. And of course, there's no right or wrong answer. This is just what you're doing right now, is how are you acquiring new patients? And I'm going to give Christy a minute to be able to send that over to me. Most people, I will tell you, start doing it with the screenings, right? There isn't an effective method to be able to get patients into the door. So they're at a mall, or they're at a health fair, or they're at a place that is going to be full of people, and then they start trying to drum up a conversation and be able to get patients in that way. So I'm just looking at what Christy sent. Okay, so internal referrals is a big one. That's great. Okay, but I'm gonna have a question about internal referrals for all of you guys that are out there. My question to you is, how effective is this? Now, it can be effective because 66% of you said that internal referrals is where you're getting the new patients. How effective is it, and how consistent is it? So if you're already doing internal referrals, That's great. A lot of our patients come from internal referrals just because that means to me that you're providing excellent service. So I don't need to help you become a better chiropractor. You're already an amazing chiropractor. You're providing awesome service. But what we need to do is be able to look at where are other consistent ways we're going to be able to get new patients. Now, we've all done our share of spinal screenings, right? Here I am, I've got a spine. Look at what this does. This is where your neck pain is coming from, but we pack up everything, take it all over to the health fair, and at the end of it, we just come back and are exhausted. So I find that screenings, I'm just looking at the message that she sent me. So a lot of you, some people have been doing some screenings, but I find that screenings are not as effective, right? Screenings are going to be more, and I'm going to get into this in a minute, in more of like a kaleidoscope, less like a laser beam. So we want to be able to get really targeted, really narrow into who our patient is and what kind of patient we naturally enjoy working with. So this is actually, this methodology that I'm going to share with you today is actually what landed me to being the #1 pregnancy chiropractic center in Central New York. We have one of the busiest practices in upstate New York. And probably in New York State, we're very, very busy. We see hundreds of people in our practice, and it's very efficient. It's very effective. It took a long time to get there. You know, if you don't know me, I've actually put 9 years of time into this. In that 9 years, I just tell you guys a little bit about my personal life. I was not married. I was not dating. I do not have kids of my own. You know, I recently got married about 2 years ago, but for those 9 years, I really buckled down and got the systems in place that got my practice to be as successful as it is. And I got everything automated, and so now I sit more on top of the business. And now my goal is to really open up other locations and help more chiropractors be able to do the same. So this system that I'm going to now share with you, and you may want to start taking notes. I know that this is recorded, so you may be able to go back to it as well. I worked with pregnancy. You may not be passionate about pregnancy, and that's okay, because this works with anything. It works with, if you want to do TMJ, you can use the system and modify it to dentists or other doctors. If you want to work with migraines, you can modify this with internists or with neurologists. If you want to work with thoracic outlet syndrome, I mean, the sky is the limit. So I've done this system for pregnancy. We have about 17 different pregnancy providers, mostly all OBGYNs. The majority of them are OBGYNs. A few are midwives, but the majority are OBGYNs that are referring pregnant patients to us constantly. And that same thing is what my goal is for you, but you may not want to focus on pregnancy, and that's okay. You can focus on what you're passionate about. I'm going to show you how to do that. So working with medical doctors is going to be really a targeted approach. It's a laser beam approach, and you're not going through it as a kaleidoscope. So you're not randomly waiting for a new patient to come in from an existing referral or from Google or from something. This is a very targeted approach. So it's a laser beam approach, and that's why I love it. And you're going to see exactly how. So my plan for you with the time that we have is that you're going to become the go-to expert. And I'm going to share with you at the end, you know, the program that we use as well, and you're going to be able to understand a little bit more about it. But here you're going to understand the components of it. Working with medical doctors is a laser beam. I'm going to show you the slide again, but it's also the path of least resistance. And that's what we all need right now, right? I'm sure all of you could use some reprieve, right, from the world and what's going on. You know, it's a crazy world right now. So we need the path of least resistance. We want the easiest way to get there. And that's why I find working with medical doctors is the easiest way once you have the system in place. It's the best way to be able to get new patients consistently. We're going to look at these 9 different components here, okay? So number 1, you must give in order to get. Number 2, you must speak in the evidence-based language of the medical doctor. Number 3, you need to zero in on that ideal client that you're passionate about working with. Number 4, you need to think laser beam, not kaleidoscope. Number 5, we need to focus in on the type of doctor that services the type of patient you're passionate about, right? So you're passionate about pediatrics, of course you're gonna zone in on the pediatrician. You're passionate about pregnancy, you're gonna zone in on the OBGYN. Headaches, migraines, neurologist is gonna be your provider. Having a clear system and procedure. If you don't remember anything I talk about in this session, I want you to remember this one, and I want you to circle this. Having a clear system and procedure to keep track of the doctors you have worked with and who are referring regularly. This is really gold right here, because if you don't have a clear system, you're not going to have any idea about what's going on and what's happened before and who's been referring and who hasn't been referring. So I'm going to show you my system. You will send new patient information and notes to the doctors who referred the patient and follow-up notes, as well as quarterly checkups with the MDs, and then getting great systems in place to handle all the new patients that are going to be coming your way. So let's just jump right in. So the main thing is going to be getting past the gatekeeper. What do I mean by the gatekeeper? Now, we have a gatekeeper in our own practices, right? We have our front desk person. That front desk person has been trained to be able to weed out the riffraff. Just say it that way, right? They're weeding out all of those people that really you don't want to deal with, right? So the other day, my front desk person said, Dr. Tahir, I've got 5 messages for you. Someone for SEO, and I said, nope, not interested. CBD oil, nope, not interested. And he's got all of these different people that want to get to me. So in a medical doctor's practice, the gatekeeper is going to be the same way, right? They're trying to weed out people. So we get a lot of people in our 6-hour class that have already tried to go to a medical doctor. They've already dropped off brochures. They've already dropped off business cards. They've already tried this before and they've been defeated. And it's because they haven't been able to get past the gatekeeper. Now I'm going to give you a secret. The gatekeeper is really not that important. They're very important, but they're not the decision maker. So there's going to be very specific language that we go delve. Of course, this is just an hour long. We have to delve deeper into this, but there's specific language that you have to do. You have to be able to say to be able to get past the gatekeeper. And that gatekeeper has been trained to be able to shut you down. So one thing I'm going to tell you is that if they are, seem upset or they're telling you no, you can't take it personally. And it's easy to take it personally because let me tell you, again, me being as confident as I am, I was insecure in the very, very beginning around this. So I'm sure you're going to have some insecurities going into the doctor's office. It's not natural for, us to go into this doctor's practice, and especially because sometimes there is a rift between medicine and chiropractic. So getting past the gatekeeper is really, really important. So you want to come at it from the angle of we're building a partnership. We want to engage we want to engage the patient. We want to be able to build a relationship. And I'm going to share with you how to do that. So now the second thing is that after the gatekeeper, you want to make sure that and here with the gatekeeper is where we're using this principle right here, you must give in order to get, okay? So even if you're giving a smile, even if you're giving some information, if you're giving something to the gatekeeper, that's how you're going to be able to get back what you need, which is to get access to behind the glass door. Number 2, we need to zero in on the type of patient your practice is passionate about working with. So we go into something called an ideal client exercise. It's kind of almost like a very thorough, in-depth way to be able to find out and target what your ideal client is. Now, I'm not going to have time to go, unfortunately, through the ideal client exercise because it takes a little bit of time. But what you can start doing is zeroing in and thinking about it. What are the type of asking yourself, what is the kind of patient that you're really passionate about working with? And I'm going to give you about 30 seconds to really write that down and think about what type of patient you're really passionate about working with. So most people, are going to say, okay, well, in our practice, we don't see a lot of the Medicare population. And it's not because we don't love the elderly. My grandma's 96. I love my grandma. I love the elderly population. But we're not passionate about working with the elderly because it's just not really the right fit for our practice. We move very quickly. Most of our elderly or Medicare population that do come in are people that are really, really active. They travel the world. They're, very engaged. They're doing yoga. They're doing all sorts of different things. So a Medicare patient may not be the right fit for my practice, but they're going to be a fit for the other 125 or so chiropractors that are in my area. I want to zone in on the patient that I love working with, and we love working with pregnancy. I really want to, now that I've done the pregnancy part of it and I've gotten that system down, I'm going to use this exact system to start working with concussions, because I'm also really passionate about working with post-concussion syndrome. I'm going to use then the same thing that we're going to be using with herniated discs. So we have another chiropractor that we just signed on just the other day. We're going to share with him this exact system. And you can have your associates do this. You can actually have a lot of your front desk and your staff do this. So they take this class, so they do this, and then they start zeroing in on what they're really passionate about working with. And, I work with the associate's passion. So this associate is really passionate about herniated discs. So I'm going to zero in on that. And that's how we start bringing in new patients. This is why and how we're going to fix that break leg pain that we talked about, that painkiller pain. We need to increase the overall number of revenue and increase the patients that are coming in. And a lot of you, secondarily, if I look at the poll from the beginning, Christy, we mentioned about 21% of people said that they don't have enough time. Not enough time. So not enough time, not enough money. This system is going to solve that, because you're not going out and doing marketing. You're not out spending money on Facebook ads, in my opinion. I mean, nothing wrong with Facebook ads or anything like that. I don't claim to be a social media expert by any means. But people are spending hundreds and thousands of dollars into ads, which is great. But if you build relationships, relationships will never die, right? I was telling someone that, and again, you can use Facebook ads, not a problem. But what happens tomorrow if Facebook starts charging all small businesses an exorbitant amount? So it can really it's only large businesses that are able to really get into that market and using Facebook ads. Maybe your market's not saturated right now, but maybe it will be. I will tell you this, no one in your community, very little probability that other chiropractors in your community are going out of their way to use this system to be able to start working with medical doctors and other providers. Okay, so you want to start zeroing in on the type of patient that you want to work with. Having a clear system in place to generate and keep track of medical doctor referrals. This is key. So one of the things we teach, and like I said, one of the biggest complaints that we get from chiropractors is staff and staff management. So I'm a big proponent of what you expect, you must inspect. And so if you expect something, you need to be able to inspect it. So here, this is a really good tracking sheet, okay? This is a really, really good tracking sheet here. And it's an example of something that this is my tracking sheet. So we have a tracking sheet based on the name of the doctor, the name of the practice, all of the practice associates that work there, any comments that we have, and then did we contact. So we put the comments right in here. As soon as something happens with the medical doctors and you get that appointment, because that's the goal, is getting the appointment, saying the right things to get the appointment. So when you get that appointment, you want to start putting that right in here into the comment section. And as you do that, you're going to be able to keep track of it. Now, you can actually have some of your staff, because some of you did say you don't have enough time, you can have some of your staff do this. I wouldn't recommend they're the ones going in to talk to the medical doctors. I really do believe the doctor themselves should go in and do that. But a lot of this back-end work can be taught to an hourly worker, and that's not a problem. Now remember, again, this is how we're going to get long-term patients. Because why? Remember this. When a patient's medical doctor says to do something, what are the chances that you think that they're going to do that thing? Very high, right? Because in society, people believe that doctors, they know it all. They're smart enough, they know all of the knowledge, they know everything that they need to about my care. They're telling me to go to High Point Chiropractic Wellness. I'm gonna go to High Point Chiropractic Wellness. My OBGYN saying that they trust Dr. Tahir, I'm going to go to Dr. Tahir. So just like this is very important. When we think hand sanitizer, we think Purell. Right? It just goes hand in hand. When we think tissues, we think Kleenex. When we think coffee, some of us think Starbucks. Other people may think Dunkin' Donuts, right? My point being is I want you to get to a point And again, like we delve deeper into this because the class is really 6 hours that we really teach. So I'm kind of getting to everything I can here. The key is going to be, you're going to become that go-to expert. So let me give you an example. We had a client that was in our previous MD referral course, and they wanted to become known as the hand and foot expert. So they wanted to be known as the place where doctors were going to send their patients that had carpal tunnel, plantar fasciitis, anything to do with the hand and foot that wasn't spinal related. They adjust the spine as well, but they really, really, really have a skill with the hand and foot. And they've done all this extra training. So we show them exactly step by step how to showcase that to the doctors. That's going to be the key. And then you can become known as the hand and foot expert if that's what you want, or you become known as the migraine expert, or you become known as the pregnancy expert like I have. So it starts with this tracking sheet here. You have to speak in the language of the medical doctor, okay? So I have a very wellness-based practice. My practice is called High Point Chiropractic Wellness. It's a wellness-based practice, right? So we move people out of like that acute situation, subacute situation, and most people are on some kind of a maintenance type of adjustment, okay? Our PVA is pretty high. I'm very proud of that. I'm not, bragging or anything, but the point that I'm trying to make about that is that we like wellness-based patients. We like our patients being maintenance-based as well. So these long-term patients come in from the medical doctor because the medical doctor trusts you. You have to use an evidence-based approach. So using what they think that they know and how they operate, you have to think in the mindset of the medical doctor. And I like to get into the psychology of this a little bit more. If you know me, you know that I'm really, really passionate about chiropractic, and I want every man, woman, and child under chiropractic care. And, from birth to death, I believe chiropractic just enhances life, changes lives. It helps us rebound from injuries quicker. It helps us be able to respond to stress better. It creates internal peace in the body. I mean, I love chiropractic. I myself get adjusted regularly, and I know you love chiropractic. But the doctor doesn't understand innate, and they don't understand autonomic nervous system and how that's all connected. They don't understand that. They understand neuromusculoskeletal. So even though I have a wellness-based practice, we have to use this evidence-based neuromusculoskeletal way of talking to them about it. And then when those patients are in your practice, then you start educating them about wellness. You educate them about maintenance. Help them understand that this is not a quick fix, that this is going to take a bit of time, and that you want to get to the root of the problem. So when you're building your practice with a medical doctor relationship program, you have to start understanding the psychology of the doctor. So let me give you an example. My dad is a medical doctor. I mentioned that. Growing up, I saw pharmaceutical reps. That was back in the 90s and the early 2000s, where pharmaceutical reps were really embedded into medical practices. They were giving away trips, vacations. I mean, our family has experienced those things, I'm talking about every glass, every mug had, every pen, every notepad has some kind of medical name on it. Clocks. Umbrellas, these are things that we used growing up that said Paxil and Augmentin and Imitrex. I mean, I remember the names, Claritin. So it was very much embedded into the medical doctor's practice, the name of the medicine that they were supposed to refer. So in the medical doctor relationship program, which, like I said, is a bit more in depth, it's 6 hours long. But one of the biggest things you have to understand is the psychology of the doctor and the WIFM, what's in it for them. What do they understand about chiropractic? What are their objections about chiropractic? How do you handle those objections about chiropractic? How do you manage, the things that they think about chiropractic? And, I had another opportunity to be able to speak on a cruise. It's pretty cool. It was a Mediterranean cruise with medical doctors, Now at this point, pharmaceutical companies, they're banned from doing, the things that they used to do before, but they still have their ways of getting people on these drugs, right? So anyway, that's an aside, but I was able to work with medical doctors that invited me to come and speak on this cruise. It was pretty cool. And they were getting their CME credits, and they wanted to have me speak about chiropractic and building this relationship. And my goal in life is to educate medical doctors, because I feel like if they refer more to chiropractors, just like you and me, then we'll increase the utilization rate, like I mentioned before. But the interesting thing is I was presenting to medical doctors. There was probably about 250, maybe 300 doctors that were taking this program. And as I was presenting, I tried to handle all of their objections in the presentation. And that's going to be the key, because there's a very important and very specific way of how to handle those objections. So, because I knew that I want, 250 medical doctors just spitting out their questions to me at the end and throwing darts at me. No, I didn't want that. I tried to handle as many objections as possible. But what I found is that, so they didn't have as many objections at the end because I handled it in the presentation, but they still had questions and they still had concerns, and they questioned the safety of chiropractic, and that's a big thing. So it's important to be able to understand how to explain that. One of the biggest things is that, you have to be able to talk about it in their language, like I mentioned. So research is important. So according to JMPT, 84% of women who received spinal manipulative therapy while pregnant reported relief of back pain during pregnancy. There was also a significant reduction of back labor during delivery when spinal manipulative therapy was used. So we want to showcase, how is this benefiting the patient? Okay, now remember, this is all a part of like that painkiller pain that you mentioned. Not enough time, not enough money, right? And having to scramble maybe for new patients and having a stress around that. So we have to be able to get comfortable with the uncomfortable. And I'll tell you this, is confidence. I'm confident I can present anything to a medical doctor. It could be about pregnancy, it could be about TOS, it could be about migraines, whatever the case may be. But that confidence, like I mentioned before, I shared with you because you're my friends here, I was insecure before about this. So where did that confidence come from? Confidence comes from certainty, and certainty comes from knowledge. So if you understand the skill set of understanding how to present to the doctors, then you're golden. Then you just sit back and you just have the referral streams coming in if you do the system right. Like I mentioned before, their biggest concern is safety. So chiropractic is safe for pregnant women, right? There's no known contraindications of chiropractic to pregnancy. The chiropractors, the High Point Chiropractic Wellness, which is the name of my practice, have received additional training to work with pregnant women. And then we talk about complaints, right? So again, you may be doing this for TOS, like you are modifying this for your special type of condition that you want to work with, right? But we look at all the different complaints that a patient may have. I want you to take a quick look at this. Okay, this is a brochure that I created. And if anyone's interested in this, I'm very accessible through Facebook. I also have actually sharing my personal cell phone number at the end of this. You can text me. I will reply. It is not a robot sending you a message back. It is literally me texting you back. That's how committed I am to chiropractic. I'm giving my cell phone out and my email address. So I want you to look at this. Okay, this brochure here took me a while to create, but it's very important because it's been created for the layperson. But it's also been created for the medical doctor. And what I want is I want that medical doctor to get to a point. Now, of course, like I mentioned, there's steps and steps and steps and steps and steps that get to this point. And I'm doing my best to share all the steps with you here, right, in the short time that we have together today. But by the time they get to the point where they hand out this brochure and they say, you need to go to High Point Chiropractic Wellness. You need to go to Dr. Tahir. That's where you need to go. So you don't want the doctor, you don't want the medical doctor to get to all of this and say, oh, you need to go to a chiropractor. Of course, we want them to go to a chiropractor. But what we really want is we want them to go to you as the chiropractor. And that's where you're going to have the path of least resistance. We need more joy in our life. We need more ease in our life. We need more, I don't know how many times people have said they need more peace in their life. This working with medical doctors and presenting things in a certain way is what's going to get rid of that painkiller pain. That's what's going to do it. So that's the way that I found. That's the way that I train, my clients to be able to understand it. And my approach is very much relationship based. So when I'm teaching you about this, I've got to make sure to understand what it is that you want. I'm not trying to turn you into my practice. We have to find out what it is that you want. And you really have to start thinking about this. Like, what do you love? What do you want to be doing? How can we start blossoming that, growing it, and getting it automated to a point where you don't have to be the one doing everything and you're not burnt out? I know I was getting burnt out. So now we're sending notes regularly to the medical doctor with the exam findings, follow-up notes, and any changes in health history. I will tell you this, if you're not able to promise this, do not tell them that you will do this. If you do not have a good system in place to be able to manage this, do not tell them that you're going to send follow-up notes. That's not going to be good. So a lot of what I teach is cutting the learning curve, and it's really been from skinning my own knees, right? I'll give you an example, right? Because we're amongst friends. So I had an employee that I had hired that was supposed to be in charge of this, sending notes regularly to medical doctors with the exam findings, follow-up notes, and everything. And for some reason, I started seeing that our referrals were going down, and we weren't getting as many new patients in the door. And of course, like everything, I go and diagnose it in the practice, and I assess it, and I figure out where the issue is. And this is what I really like to do with our clients. Like, I like to go in and diagnose where the problem is, and I can very quickly identify it, and I find out the notes haven't been getting sent out. I was infuriated. I'm not going to lie to you. I was literally livid. I was so infuriated. This employee had already been doing other things that shouldn't have been getting done. Like, I'm giving you an example. She left the door unlocked to the practice all night. We were in the middle of a city. She left the door, and thank God nothing happened, but that happened. There's all sorts of things that had happened that she had done. But this started pointing to those things. And I started looking a little bit more, and I go, oh, she hasn't been doing this. What else has she not been doing? And then I found out about all these other things. And of course, employee management is a whole thing. You have to document everything. So I kept documenting everything, and eventually had to terminate her, which nobody likes to do, and I don't like to do at all, because I like to be a very loyal, committed employer. But we had to do it. So the thing is, my point being is that what you expect, you must inspect. And for this, you need to have a system in place. You need to have a really clear system in place. And I like to go a little bit more in depth into that. Now, lastly, as we wrap up, I want to share with you insurance versus maintenance care. Now, you do have the opportunity to ask questions. Christy will be sending those to me by text. Right, Christy? So she's going to send any questions that you have, and I'd love to spend a little bit of time answering those questions as well. And I will be sharing with you in a bit at the end all of my contact information. Like I said, I do reply to every text. If you know me, you know that I'm very quick. I try to be as quickly as possible and respond to your emails and to your text messages. I like text. Maybe people don't think, hey, it's not professional. I think it's very professional if I'm responding to you quickly to your need. So that's my opinion. But obviously, I don't use text for our patients or anything like that. I don't think that's good. But for our colleagues, of course. So, it's our responsibility as chiropractic, to be able to educate the patient. I truly believe that. And it's one of the things that I really like to teach. There's so many patients that are going to come in. Of course, they're going to come in with some kind of condition, some kind of injury, some kind of acute problem. How do we convert those patients into wellness-based care where they're coming in for maintenance care? And we know that the standards of insurance are changing. This is not the Mercedes 80s anymore, right? Where standards are, Medicare is becoming the gold standard. So we know that we're really only able to bill. And am I an insurance compliance specialist? Absolutely not. ChiroHealthUSA has wonderful resources for this as well. But the thing is that you have to have some kind of plan to be able to convert people from that insurance into cash or into a care plan types of situation. We know that we can't bill out for maintenance care. Most plans, there's very, very, very few that are left that you can actually have a number of visits or something like that. And so after insurance has ended, you need to understand that there is going to be a plan of action. and be able to use that. Maybe some of you may already have that, and if you do, that's kudos to you. So I'm just going to go into this MD referral program that we do, because Christy had wanted me to share a little bit more about it. I want to really explain this. So what we do is I go through. Now, of course, we only had about 45 minutes to an hour here. You can tell I'm super passionate about it. Like, I live this stuff. My husband sometimes gets crazy because he goes, "Oh my God, you like live and die chiropractic. Like, it's literally everything you do, every conversation." And maybe I'm a little over the top with it, but I do live it because I'm passionate about getting people like you, our friends, our family, and our clients more patients in the door and work with medical doctors and get rid of that break leg pain. I want you to have that path of least resistance. Like, we just are in a tumultuous time in some ways, and I think all of us need more peace and we need more understanding, and I think that we can do that by being able to make the changes that we need to in our own life. So I don't want you to have that break leg pain. I empathize with you about that break. Like, I've been there myself, I know what that feels like. And so in this MD referral program, it's a 6-hour class, and you literally learn the exact system I use to become the #1 pregnancy chiropractic center, and then I will use to become the #1 concussion center and the #1 herniated disc center in central New York or upstate New York. You're going to learn to use the specific language to get past the gatekeeper. This in itself, we spent about 45 minutes in the class with, and there is very specific language to be able to get past that gatekeeper and to be able to get that authoritativeness that you need to. Collaborate with the MD for the best patient care. Of course, at the end of the day, it's all going to be about collaboration. So how do you actually collaborate with the MD? Articulate what sets you apart from physical therapy and other chiropractors. You have to learn to handle this objection while you're in that appointment with the MD. And remember, you're not going to have an hour with the MD. You're not going out to lunch with the MD. They don't have time for that. You have literally between 5 to 12 minutes, and you're going to be able to tell them everything they need to be able to get that referral in the door. And that's exactly what I teach you. We're going to teach you a very clear, systematic, and methodical approach to how to present to medical doctors and handle their objections, right? Like when they say, "Is chiropractic safe?" I already refer to a physical therapist. I don't need another chiropractor. I mean, how do you become known as the go-to expert in your community, where we zero in on that type of patient that you actually enjoy helping the most, right? Like I said, for me, it's pregnant women. For you, it may be thoracic outlet syndrome. Maybe you do love that Medicare population, the geriatric population. We've had a couple of our clients that have done that. We have one of our clients that went through this program, doubled their revenue, hired more staff, in the middle of Missouri. I mean, this is awesome. I built my practice in 2007 in the middle of the worst recession that we have ever had in a country. I believe that we have to put things in place to become recession-proof as chiropractors. Unfortunately, most chiropractors are 2 months away from bankruptcy. That's the statistics. I'm not making this up. It's 2 months away. So we have enough income to be able to sustain for 2 months. So if you don't have patients coming in for 2 months, what happens to the practice? And that's what I fear. I fear that chiropractors are going to go out of business, and I already see it, and it's heartbreaking to me. So I want to help you. That's my joy, is to be able to help get you to this place where, like, I'm so excited about this, and I don't have that break leg pain anymore. And so the way we do it is it's a live online course. This is not a download. You are going to be given individual attention. The next classes that we have coming up are June 11th and June 12th, and those are going to be 12 to 3 p.m. Eastern time. Or we have another option of June 18th. That class is from 2 to 5 p.m. And June 19th, and that is from 12 to 3 p.m. And I will tell you guys, if you need to move patients around and like kind of put them around this block, do it, because the people that have taken this class already have already started exploding their practice. And I mean, we've only been doing it this way with this specific class for a window of time. We've been teaching this exact program for the last 2 years, but I wanted to extract it, and I wanted to make it more comprehensive, and I wanted to be really thorough with it and go deep into it. And it has been awesome because people have walked away with more confidence, more certainty in how to collaborate with medical doctors. They're starting to get tons of new patients in the door, and they haven't even put into place everything that we've talked about yet. So they learn how to handle those objections. They send us these texts and they say, "You know what, I went in and I talked to the doctors, or I did these neuropathy program, and I've gotten all this income that's coming in from here." And so, we have one doctor, Dr. Nicole, and she's in Baltimore area, and she wanted to focus on neuropathy. And so we taught her how to work with medical doctors that see neuropathy cases. And you know what? A lot of doctors don't know what to do for neuropathy anymore. Like people who are diabetics or people who have this nerve loss. How many people's lives can you change with that? So now we taught her how exactly to zone in on that, how to get through the gatekeeper, how to present to the doctor. I kid you not, she sent me this text. I should have incorporated it in here. Last week, she gained 5 new patients, and she has a kind of like this program that she does. Again, I'm not trying to make you me. She wants to do these sort of packages. That's fine. That's how you want to do it. Go ahead. If you don't want to do it that way, that's not a problem either. But she wants to do a package. So she sold 4 of her premium packages and 1 of her basic packages. It equated to something like $18,900. You know, that's income. This is a woman I met at Parker Seminars last year who was, after my talk, was crying. And she was like, I don't even know what to do anymore. I'm humiliated. I don't even know. I don't know how to get the income into my practice. And she's a beautiful woman, a confident woman, but she didn't have the skill set. And that's what I want to teach you. So we're going to go through step by step exactly how to do it. You're going to get your questions answered. We do give a certificate of completion afterwards, and you're going to learn how to target these exact referrals from the MDs and collaborate with them. And you're going to start eliminating marketing dollars. You know, we have another client that's in Michigan right now, and she's been spending something like $700-800 a month on ads and referrals, and that's okay. You can do that. But where can that $700 go? You know, that return on the investment, what is that going to be? So we teach you how to do this and present to the MDs at a very, very, very low cost for the MDs, for a very low cost to you. You don't have to put a lot in. You know, some of it is going to be maybe building brochures, and I'm going to show you how to build a PowerPoint. You know, I'm going to show you exactly step by step, like what I did, and you're going to do the exact same thing. I'm not smarter than you are. You know, I just have the knowledge. I've just skinned my knees, and I have that learning curve, right, that I've done. So, you know, with the ChiroHealthUSA, I wanted to do this because I love ChiroHealthUSA. I love Christy. I love Heather. I love everything that they do. If you go into the link, Christy's going to share that with you. The link is right here, ignite-spark.com/plans-pricing. You put that in, and you click on the blue button on checkout. You put in Ignite. That'll give you $100 off. And that's something we only give to our private coaching clients, but we want to give this to ChiroHealthUSA, and we want to give this to all of our wonderful friends here today. And I want to answer a couple of these questions, and I also want to give you this is my information here. You can take a picture. You can actually look at our Ignite the Spark website. You'll be able to see testimonials on there, people who've gone through it, and you're going to be able to, you know, see the phone number and everything here as well. So let me go to these questions as we wrap up. A lot of doctors in this area, chiropractors, have a stigma of being personal injury lawyer-driven charlatans. How do you manage that image with medical doctors? Great question. Okay, so you have to show how you are, doctor. I wish I had seen the name on here. Doctor, you have to be able to see what is going to set you apart. So you have to start understanding, how are you going to showcase to the medical doctor, that's exactly what we do in this class, is how are you different and distinct? Because I don't want them to just refer to a chiropractor. I want them to refer to you. You know, and again, it does not matter. We have had people who do only upper cervical care. We have had people who only do PI. We've had people who only do pediatrics. We have people who only take cash. We have had people who only do insurance. We have people who do tons of Medicare. Literally, this works. It's agnostic of personality type, agnostic of your location, insurance. It's agnostic of your philosophy. We have people who are from all different types of walks of life, and we have done this actually internationally as well. So it does not matter where you're from. I'm telling you, this class is going to start changing your life, and it's going to start getting rid of that painkiller pain. But you have to distinguish yourself as different. Terrific presentation. Thank you. I really appreciate that. My question is, areas with lower socioeconomic income, patients mostly on government medical plans, how do you get them to pay cash? Okay, that's a whole other thing that you can actually text me about. That's a way more in-depth question. I will tell you this, that when you're working with medical doctors, you want to showcase that you take on those patients, that you can specialize in those patients. In our practice, we have a percentage that we actually give as a hardship rate because we want to help people, you know, the refugee community. We have a huge refugee population. We want to help with people who just don't have the money. You know, maybe we're a single mom or whatever the case may be. We help get those plans in place too. And that's something I can help you with. Question 3, do you compensate referring MDs? Absolutely not. Okay, I want to make sure you know this. We are literally Never, ever, ever, ever. That is illegal. You are not going to give them money. You're not going to give them anything. You are literally not doing anything except giving information. That's a great question. I really appreciate you asking that because I didn't get a chance to get to that. But do not, under any circumstances, give any money or any gifts or anything to the doctor. That is illegal, because remember, that's what the pharmaceutical reps were doing. You cannot do that. But we do use the psychology, and we do use the understanding of the pharmaceutical system of what they used to do, and we get that in, but not with compensation. You do not, under any circumstances, do that. Question 4, Dr. Anthony, thank you. Does this work for a cash practice other than medical? Of course, yes. This works. This is agnostic of the type of, even it's agnostic of personality. You don't have to have my personality. You don't have to have a type A personality. You could be more of an introvert. This actually works beautifully for introverts, because introverts don't like to go out into the screenings and all this kind of stuff. Sometimes it's hard for them to ask patients for referrals. So no, it works for cash, it works for all insurance, it works for if you only do care plans, it works if you do wellness-based care, it works if you're a vitalistic practice, it works if you're a pain-based practice. I'm not here to teach you how to practice. I'm here to enhance that and give you this information on how you're going to work with medical doctors, because it works no matter what. We've had the gamut in our program, like I said, from upper cervical to all PI to anything, and we've been able to make amazing leaps and bounds with that.
Okay, well, thank you. See why I'm such a fangirl? Like, I love her. And when I finally met her in person in Vegas after silently stalking her, which I had to openly admit to recently, I was like, please don't freak out. You don't want to be my friend anymore.
Yeah, no. I know you're my president of my fan club, right? As I'm the president of yours.
That's right.
Yeah.
Heather's fixing to chat in here and go, no, excuse me, I'm the president of your fan club. But y'all, I'm so excited. Okay, so Alicia is saying that the Ignite code is not working, so we'll get Dr. Tahir will look at that, and we'll get that.
Okay, so you should be able to press on the Buy Now blue button and put in Ignite. I checked it yesterday in the discount code, and you should be able to use that. If not, just text me or message me. I will give this to you. Just mention that you're ChiroHealthUSA, or I'm also on Facebook. I will get that to you right now, or I'll just honor it for you. You know, like, I apologize if it isn't working. It should be working. Like I was going to say as well, if you have any problems with signing up with it, I don't want that to be a deterrent. Just contact me, message me. I am very available to you, and I will help you through it, and I'll just honor that code. I'll make it easy for you. Don't worry.
Y'all know how technology is. It's temperamental.
Yes, it can be temperamental. And I apologize if that code's not working, but it really should be. So if you have any problems with it, definitely let me know. I am available. I've actually cleared the rest of my day for this because I really wanted to make sure that I, really I'm here for you and for ChiroHealthUSA. And relationships are very important to me. So I'm right here.
And I hope y'all can get this. It's such a different experience to hear people speak on a webinar versus live and in person. And y'all know me, I'm picky when it comes to deciding who's going to speak to my beloved friends in chiropractic on this webinar series. But I can tell you, from the moment that I met her, she did not disappoint. The authenticity and her love and compassion to help other chiropractors is very genuine, or she wouldn't be here for sure. But I just want to tell y'all that she's just amazing. I mean, bottom line, she's just amazing. So reach out to her. If you're not following her on Facebook, you should, because she's fabulous, and she always posts really great information that's super helpful. It's really funny because you give away so much information. Sometimes I forget that you actually consult.
Well, that's the thing is, I want to, this is only an hour long. I wish I could teach the whole thing here. So, it's only an hour long. I'm trying to consolidate everything into it. And like I said, I'm happy to answer more questions. Definitely follow me on Facebook. I'm very responsive on Messenger. I have it downloaded on my phone. I try to be very quick, even with email. So, follow me on Facebook. I have probably like 500 people just sitting in my inbox in Facebook. So if you add me now, I will just add you. I have had those people just kind of sitting there. I'm not sure what to do. So I'm approaching my friend limit. So I'd like to just add you guys on there. I'm also on Instagram at Irum Smiley. You can add me, follow me on there. I'd like to give away as much information as possible. And then I have a Dr. Irum Tahir page as well. The other thing I didn't mention is we have a private Ignite the Spark group. So if you look up Ignite the Spark on a private Facebook group, we always give up tons of information that I've shared with a lot of people. Like I had a COVID screening tool. If you want that, I can share that with you. Like we do that for the group. We try to share as much information. If I'm doing something in my practice, I try to share it in the group, and it's all free as well. But we'd love to get you into the class. I know that it'll start changing your life and change that break leg pain. I don't want you to have to suffer anymore.
And then after it changes your life and you love it, please send me an email. Let me know how it's going, because I love to hear feedback about how things are going. So make sure y'all let me know how it was. And don't forget to rate today's webinar, because y'all know that ratings are everything at the ChiroHealthUSA weekly webinar series. I just want to thank you again, Dr. Tahir, for being here today. And thank y'all so much for attending this webinar. Remind you, next week, we're going to switch gears a little bit, and we're going to talk about bulletproofing your medical lien agreements. We're going to have Dr. Michael Copes, the attorney, here again. That following week, we're going to talk about chiropractic content marketing, 5 things you can do right now to help your business grow. Very essential post-COVID-19. And then we're going to talk about, because y'all know me, I'm all about the stuff of being an entrepreneur. I love your chiropractic heart, but you are also business owners, and I want to always focus on that as often as I can. We're going to have Dr. Jay Greenstein here talking about the chiropractic entrepreneur framework to help you balance those jobs that you have as being the business owner, and then being able to follow your heart and do what breathes joy in your life, which is treating your patients, and how to make all of that work into a successful business. So if you have not already, please go and register for those webinars at ChiroHealthUSA.com/webinars. I want to thank you again for taking time out of your incredibly busy day to be a part of today's presentation. And I cannot wait to see you again next week. Bye, everybody.
Bye. If there's any other questions, let me know. I'm here.